I became a doctor because of ultimately my interest in the brain and trying to figure out ways that we could restore function of the brain because it's so central to who we are as people. We had a career fair during 8th grade, and one of my classmates, her father was a neurologist. He brought in the brain of a quote-unquote healthy patient versus the brain of an Alzheimer's patient. And it was such a stark contrast in terms of what the brain looked like with the diseased brain. And I think that that was probably one of the first times where I was really thinking, oh my goodness, the brain can get damaged in such a way, what can we do to kind of fix it? My name is Chen. I'm an assistant professor at Penn Neurosurgery. I do brain tumor surgeries, and also I do procedures in an area called functional neurosurgery, which currently involves deep brain stimulation and epilepsy surgery. A big focus of my research is to figure out, can we rebuild the brain after it's been damaged? After a stroke, traumatic brain injury, degenerative disease like Alzheimer's or Parkinson's disease, can we physically rebuild the brain to restore function in patients? I'm also involved in covering the trauma center at Penn Presbyterian, and so anyone that comes in with a brain trauma or a spine trauma, those are also patients that I see. And I think that the trend in the future is going to be much less invasive procedures, and we're already seeing that right now. So that's one of the areas I do focus on, where we do what we call stereotactic procedures, where we keep things minimally invasive to do biopsies, but also to put in laser probes to ablate tumors, trying to do this in a way that patients can kind of bounce back much quicker. Every patient is unique, and every patient deserves unique care. And so I strive to provide that unique care by developing a relationship with that patient and their families, and to really be able to understand what makes them tick and what they need from me.